Okay, hello everybody. Thank you all for joining us. My name is Cameron Luther. I'm an economic associate with Regional Economic Models, and I'm going to be facilitating today's webinar. I am joined by Vanessa Vargas of Sandia National Labs and Walter Baylor of Sandia National Labs as well. Before we get started, I'm going to take us through a few housekeeping notes to make sure everything goes smoothly here. So this is a redux of a previous webinar. We are hopefully not going to be having any audio issues, but if we do, I'll ask you to all please be patient with us as we're kind of working through our kind of technical issues. Everybody's kind of dealing with the limits of meeting capacity right now with these web systems. And we've got somebody online who's going to be assisting us and making sure the audio quality is consistent and acceptable. We're going to be issuing the slides and the recording after today's webinar as well. So if there are any audio issues, usually those do not show up or are not as bad as a presentation might be, or not to say it's bad, but you know, sometimes the audio can be garbled through one's speakers or through one's internet, but our recording is usually quite sound. So if you have any trouble understanding certain segments, I'll let you know that you can have access to the slides and the recording later, which should help with some of those issues. For those not familiar with the GoToMeeting and GoToWebinar platforms, you can see on your little panel here off to the side that you have a tab where you're able to ask questions. If you want to type in that tab and post any question you might have throughout today's webinar, we'll be happy to address it if it's immediately pertinent to something that's on the screen, or to save it towards the end of the presentation if it's sort of more appropriately addressed in that context. So please feel free to address questions throughout. Anything else? I think that should be it. Thank you all so much for your attendance. We really appreciate your interest in today's topic. I know it is of utmost interest to a lot of people. This is actually a re-presentation of a webinar that we gave last week that had one of our highest ever attendances for a client-led webinar. So we're very excited about the topic. It's very pertinent. It uses a lot of strong resources and I think addresses questions that are on a lot of people's minds right now. So we're very proud to be able to host our two experienced and knowledgeable speakers today. And we're looking forward to hearing this presentation again. So before we get started, I will give their bios and then I'll let them introduce themselves again and the topic of today's presentation. You know, I'll let them take it away afterwards, but thank you all for your attention so far, and we're looking forward to a good webinar today. So Vanessa N. Vargas is a principal staff member at Sandia National Laboratories. Her portfolio of projects ranges from electric power grid modernization to infrastructure resilience. Vanessa's research has focused on the development and application of new methods for regional and national economic impact analysis of infrastructure system disruptions and improvements. Currently, she is involved in multiple projects examining the economic impacts of radiological dispersion devices in both urban and rural environments. Vanessa holds BA and MA degrees in economics from the University of New Mexico. And our second presenter today, Walter Baylor, is currently a professional member of technical staff in the Decision Analytics Department at Sandia National Labs. In that capacity, he has developed models of complex systems for use in understanding their failure nodes and designing control and mitigation strategies. Focus areas include banking and finance, agricultural supply networks, and energy production and distribution. His most recent work is in modeling disease transmission and control. Application contexts include evaluating strategies for pandemic influenza, detecting and countering epidemics in herd animals in Afghanistan, and improving medical laboratory systems to speed diagnosis of Ebola patients in West Africa. Without further ado, I'll turn it over to today's presenters. We look forward to hearing what you have to say.
Good afternoon, everyone. This is Vanessa. Thank you for the introduction, Cameron, and thank you for the opportunity to have an encore presentation of this work. The work that we're going to present is mostly our past pandemic work, with a focus to how things will be changing as we are currently modeling the current ongoing COVID-19 pandemic. So let's move to slide number 2. So on slide number 2, I present our overall sort of analysis trajectory. And one of the things I want to emphasize is that as we increasingly account for the human part of this event, we have increasing uncertainty. So a lot of the things that we're trying to model are rapidly changing, right? People are probably involved on the phone in ad hoc policy or are currently trying to model this as it's currently developing. But really quick, we usually start this kind of scenario analysis with an initiating event, whether that's a boom or a pandemic. We have a response phase where we're trying to estimate and best represent responses either at the federal level or the state level. And at the end, we're trying to estimate the cumulative economic impact. So we have prompt effects, we have response effects, and then we have the economic effects. And part of all of that are the human decisions that go into estimating these events. But as I discussed, this is an ongoing non-scenario. So I will let Walt take over the call from here. He's going to walk through the past pandemic modeling and what's currently ongoing with regard to the epidemiological aspects and some of the resource modeling that he's doing. And then we'll go back to the economics. So go ahead, Walt. Slide 3.
Yeah, thanks everyone. This is Walt Baylor, and as Vanessa mentioned, we have had some experience in looking at modeling epidemics for the purpose of understanding how they can be managed and what the implications might be. So I wanted to talk briefly about some past efforts that Sandia has been involved in, mainly to give you a flavor for the different kinds of epidemiological models that people use and the kinds of decisions that they may inform. So if we could maybe go to the next slide, please, Cameron. So some of the modeling that we had done in the past was inform the national strategy for pandemic flu containment and the value of doing social distancing and school closures and so on was evaluated in some of that simulation. But the idea behind our approaches to this problem are to try to design models that help assess the value of possible mitigation strategies. So there's, of course, an interest in trying to forecast how the epidemic might unfold and what the possible case counts might be. But of course, that's important because you need to understand how best to control that problem. And so the models that we build are typically include both the epidemiological component, but also an understanding of how the response might be mounted and the pros and cons of different approaches to both reducing the spread or doing patient management. So the models that we put together are again typically meant to be problem focused in the sense of informing decision makers about what to do next or how the problem can be managed, and also to look at uncertainties. And of course, in this case, as in in other cases of disease outbreak, there are considerable uncertainties about the behavior of the disease, the behavior of folks in response to that, both infected folks that are infected or institutions that are responding. And so we try to be able to look at a range of possibilities in order to help people understand how the system might respond to different interventions. So there's, I think as Cameron mentioned at the outset, there's applications to zoonotic diseases, looking at how disease transmission might happen in a clinical setting, how the infrastructure, the medical laboratories might be better configured in order to support identification and suppression of disease. That was a key in looking at the Ebola outbreak. So I just wanted to give you a quick indication again of some of the styles of models that are applied to these problems, what some of the assumptions are behind those, and how, despite the uncertainty, they can be used to help guide people's responses. If you go to the next slide, please, Cameron. Okay, so again, some of the key questions that occur when you're looking at the epidemics simulation that you're confronted with in management is how do you make use of the scarce resources that are available to you? And those can be hospital resources, they may be diagnostic resources and laboratories, but how do you go about understanding how to position those given the uncertainties about the phenomenon, and perhaps given your uncertainties about what resources are even available? So general guidelines about our reliance on models, they're useful when you don't have a lot of data, when you need to explore the possible behavior of the system over a lot of possibilities. So when you really don't have enough information to specify exactly what's going to be going on, and that seems maybe a little bit counterintuitive because a lot of modeling presupposes time to do a great deal of data collection and a detailed understanding of how the system works. These kinds of problems don't admit of that kind of, don't afford the luxury to do a lot of detailed data gathering, because by the time you have a good understanding of the problem has changed or moved on. And so models that consider possible ranges, make the best use of available information, are they're both necessary, and they're able to inform decision making as long as you can portray your uncertainties within the framework of the model. And if you could go to the next slide, please, Cameron. So one of the styles of models that people use in this situation is to do a kind of a detailed representation of individuals in a particular setting. This is, and this kind of representation and the graphic here is showing the possible interactions amongst patients and clinicians inside of a hospital. And the idea is to try to understand how people interact in these small scale settings, and how changes in their policies might, changes in the way they interact, or changes in the management of the workforce or the management of the patient flow might help reduce the opportunity for transmission. Because of course, in these situations, the clinicians, the caregivers are your most precious and scarce resource, and so making sure that they're protected is critical. Sometimes that involves, of course, the physical resources, the PPEs, and those sorts of things. Sometimes that protection can be afforded by changes in the way the patient flow is managed, and so kind of detailed representations of sort of day-to-day business, and identifying opportunities where potentially dangerous interactions can be minimized is one use of modeling that's framed at this scale. If you could go to the next slide, please, Cameron. Okay. So another kind of modeling that is typically used here is a sort of a mixing cell model. And in that formalism, you're describing the population as either being in a state of susceptible or exposed or infectious or recovered is a typical way of representing a population state with respect to the disease. So in those kinds of models, you're sort of zooming out and you're looking at a larger collection of individuals, and you're trying to understand how changes in the patterns of a population's interaction might slow the rate of transition from a susceptible condition to an infectious condition. And so those kinds of models are parameterized by, you've probably all heard of the reproduction number, the R0. It's basically a representation of the complex of processes that cause individuals to interact. So rather than trying to resolve, as in that previous slide, how individuals interact with one another in a small scale setting, this sort of subsumes those detailed interactions into an overall replication parameter or an interaction parameter between two sets of populations. So these kinds of models are useful for studying the phenomenon at a larger scale and understanding perhaps peak case counts and so on the basis of the early behavior of the pandemic, the numbers as the cases accumulate over time. A problem is that they don't necessarily give you detailed insights into how those interactions might be managed in a way to reduce that overall case count. So because the reproduction parameter is kind of an aggregate of a number of factors that include both the disease and assumptions about behavior. If you could go to the next slide, please, Cameron. So maybe just talk a little bit about the pandemic influenza study. We had looked at in 2005, 2006, the effectiveness of doing changing kind of individual contact rates in the management of pandemic influenza. And part of that work involved looking at, again, the comparative effects of mitigation, but part of it looked at the economic consequences that follow on if those mitigations were not successful. So if we could take a quick look at the next slide, please. Okay, so this is looking at a possible progression of cases for a pandemic influenza, and there's sort of two things to consider here. One of them is when you're looking at phenomena at this scale, there are direct costs, of course, associated with the case, with the spread of the disease, the loss of labor, changes in demand, and this is where we begin to touch on the economic consequences. If you look at possible mitigations for those outbreaks, the school closures, the quarantines and isolations that we're all going with now, there are of course economic consequences on that end as well. And so when you're thinking about the phenomenon at this scale, it's important to try to get a handle on both what the ramifications of the disease outbreak itself would be, but then what are the ramifications of the various control measures that you might consider. So that's a segue into, I'm going to hand the mic back to Vanessa, who's going to talk a bit about how those considerations are brought together to give an estimation of consequence from an economic point of view, both from the loss directly induced by the disease, but also the trade-offs of how the management of that outbreak can have its own ramifications.
Thank you, Walt.
Sure.
So we're on slide 9 now. So this was a quick little overview of what was done in our past pandemic studies. and some of the things that we try to represent in the REMI model. So we had a stressing of the healthcare system that was affected by both absenteeism of workers getting sick and the increased demand, sort of like what we're seeing now. We had issues with regard to work from home. We varied them by industry based on what was coming out of, I believe it's the epidemiological model. And we also associated, we represented that as a likely decrease in productivity. On top of that, we had absenteeism. And that was supposed to be those that were sick or thought they were sick that would be staying home. And we had to be careful not to double count that with the work from home issues. And that was closely tied with the morbidity that was coming out of the epidemiological models. That's the illness, the rate of illness. So how did we, we had to apply that, not how, but we had to apply that through that productivity in REMI that you can kind of mess with. And we are getting re-familiarized with that aspect of the model currently. Additionally, we had to consider mortality. And what comes out of the epidemiological models is usually very specific. So we have numbers at the county level or even higher resolution than that. And they're typically over a week or over some time that is not comparable to the REMI model. The REMI model works on an annual basis. So we're going to have to utilize, again, our statistical backgrounds to adjust that to something that can be input into the REMI model. So we are currently going to start working on that issue probably later in the week or next week. And I guess that many of you on the phone are wrestling with that also. And the way we affected that last time was through the survivability in the REMI model. And we went by age cohort and I believe sex, male or female, and different age groups. And we're expecting to do the same this time around. So next slide. So generally, let's see, next slide pops up. Generally, we're going to have two shocks, a supply shock and a demand shock, and we're working our way through those now. You can see we classified last time the supply shocks as absenteeism, low productivity, mortality. Last time, again, mortality is also in the demand shock, so less people supplied, but also less people demanding things. And we adjusted the consumer behaviors through the demand side. Mitigating factors last time, we assumed delayed purchases, some level of substitution, and that online purchases would offset a lot of what was lost. This is something we're taking a closer look at and probably a heavier hand too. So I would say overall that the things we are adjusting, I would sort of relate to the psychosocial or ad hoc policy bin. We are dealing with large uncertainty. Certain states are issuing stay-at-home orders. We have non-essential businesses closed. So that's last time that was very much driven by the absenteeism and mortality, probably more than the policy response. The policy response has been very strong in some regions. And so that is something we are currently trying to represent. I'll talk a little bit more about that later, but I would consider this possibly a dramatic change from how we modeled it for the previous study. So next slide, slide 11. What we have here is just some of the tables that we pulled out of our past report. You see some of the different scenarios that were tested on the top table, and those came out of the epidemiological models and parameters that were handled. And then we made the adjustments over time. I think we modeled over a 5-year time period, and we eventually got some of the differences in GDP forecasts that are, over 1 to 10 years, not 5 years. We got some of the differences in GDP. And again, you'll see we assumed a reduction for select goods and services and assumed an increase for healthcare. And those estimates were changes in behavior, changes in consumption spending, consumption switching, were taken from the literature. We had combed through a lot of the pandemic literature, similar events, to pull sort of ranges. And I think we had things that range from like 9 to 15% on an annual basis. So that's something we're reevaluating. I think it's going to be greater than it was last time. I think we're all kind of experiencing that. So these large consumption swings. let's see, next slide, number 12. And the reason I have the SARS comparison up here is there was a large rate of death and a large psychosocial response. A lot of people demanding less goods and services, purchasing, I'll call it purchasing, basically more health care, a large amount of social distancing, more probably a likely comparison for what we're all trying to do here, that we can all kind of pull back, turn the literature and see what were the ranges, how might I apply those over time. And this has been a source of something that we've returned to time and time again. But like I said, I think the previous study, we assumed a lot of things would shift to online demand or online shopping. I think we're seeing that system is getting stressed in itself. So there's going to be dramatic departures from our previous study. And I'll try to keep you guys informed as we make those. I think we're going to get a lot of questions from the community of modelers. So if you go to slide number 13, not 3, next one. I'm basically walking through the process of how we began to estimate these cumulative impacts, and a process that's been fairly successful for us. Again, we're receiving the scenario, we're asked the question, we're all jumping on this pandemic, and we're trying to categorize the questions. Which ones are very specific to the epidemiological modeling? Which ones are very specific to psychosocial response? Which ones are very specific to policy response? Along with that, I think we've talked about mitigation strategies. We're going to see mitigation strategies on the health side, and we're eventually, or even now, seeing mitigation strategies on the economic side. So those are two things we're going to have to evaluate, probably each of us, either at the state level or national, depending on what your area of study is. So we are going to have to take the output from the epidemiological models that will be testing different mitigation strategies along the way. And I don't have a list of all of those in front of me, but we have to consider them and how that's going to change either the morbidity, the levels of sickness, or mortality, the death rate. And we're going to have to apply those to the model, again, through productivity and likely survivability. Along with that, we have the policy responses, the current ones, right? Trying to counter this that are happening at sort of the economic level. We're going to eventually have mitigations that are going to try to turn that back. So a similar study that we've done recently, not one for one, but the next slide, number 14, is let's see, it's an unclassified slide of some past work we did of a radiological dispersion device in an urban area. And I think we can all guess what urban area this is. And when we did this one, we were trying to represent the emergency response plans for the city of New York. And I always give a shout out to their New York City Emergency Management Department, because they were very forthcoming on how we might walk through one of these events. And the reason I put it up here is because there's similarities. There's a response plan, there's policy that's being implemented. There's a phase of what we call a shelter in place that happens during sort of the response phase. So we may not be calling what's happening to many of us now shelter in place. We're calling it stay home, different things. But it's kind of similar. And then over the long haul, the recovery phase, which could take years, that was very similar to the radiological dispersion device. And I would say, like, on the average for 9/11, Hurricane Katrina, a Fukushima event, it's about a 10-year recovery period. So at a minimum, we're going to be using REMI for at least 10 years. On top of that, similarities in demand for healthcare by those that are both clearly sick and those that I would categorize as worried well. So each of us will have to take that into account for the model too. You have those that are clearly sick and demanding more healthcare, and those that are likely worried well, demanding some amount of healthcare. On top of that, healthcare, my understanding is that there could be significant long-term negative health effects from this. If you get very ill, we'll have to be thinking about how those costs are passed through the economy over the lifetime of the individual. And you'll see on that middle table or middle graph, I have something called perception. And at the time, this was related to the demand for tourism and those types of events that surround tourism, going out to eat, museums, that type of stuff. And we leveraged a lot of what we saw come out of Fukushima. I think they had a decrease in demand of like 36% for some portion of the year. After the event, we applied the same kind of effect here for tourism in New York City, MSA. And so while our demand for tourism might be driven by fear or mandated, right? So we're probably going to pass it through the model the same way on the consumer demand side. How this event differs is that this was a regional event. It was mostly regionally contained. With the pandemic, this is national. What I will say is for a lot of the categories, we have business disruption, decontamination, health perception listed there. For other regions of the country that I've done this type of study, the largest driver of loss, productivity, or GDP loss has been the perception category. Encompassed in that is the avoidance behaviors and the changes in consumer demand. Avoidance behaviors can affect all of that. Staying away from something, staying home, switching your consumption from where we usually place our disposable income to categories of healthcare. So we will be modeling what we've done at the regional level and urban and rural level across the entire country for every state. So you can go to slide 15 if you want, the next one. And I'll just speak generally of how we're starting to do this. So we're accounting for, like I said, every US state, including Washington, DC. And right now, we're taking a bit of a layered approach. There's going to be a lot of different parameters and variables to think about. So lately, we've been testing different supply and demand shocks. We've created a range of those that I call scenarios that I'll call severe, cautious, and exuberant, that try to represent how recovery might take place under, large uncertainty. We don't really know going forward. In addition to that, we're trying to test how that consumption switching may pass through the model. So we have decreases in demand, but perhaps increased demand for similar categories. So think of retail. So most of us are not probably shopping for new business clothes, but we are hitting retail by hitting the grocery store more. So we're having to think about how we hit a portion of it in industry for some part of the year. Related to these categories of severe, cautious, and exuberant, we are currently dividing up our sort of annual time period into two time periods that represent basically the first 6 months of this year, in 2020, and then the second part of the year. So under severe scenario, let's say we have a decrease for the tourism industries for 6 months. I think I saw yesterday that it's been estimated that it's a 90% decline from last year. So we'd have to scale that over the 6 months for an annual model. How that might recover, you can make some assumptions for the second part of the year. Maybe it just goes to zero, just no change. Or how you might adjust that for the second part of the year. Then over the next couple of years, how you might scale that. And we're working on that currently. The next layer is going to be related to productivity. A lot of us are working from home. How do we adjust for that? I scanned the literature very quick, and it doesn't seem very conclusive. It's based on a number of factors. Home friction, how many people are at home, or your kids at home or not. IT, and how well, your overall management structure is set up for that. But I can imagine that it's a one-from-one. Coming out of some of what Walt talked about, the resource models, the beds available, the supplies, we're probably going to estimate the cost of those. My last layer I consider to be the epidemiological results and how we'll adjust every other piece of this modeling effort around that. So again, like I said, the epi results are going to probably have mitigation strategies that we'll have to account for that will change morbidity and mortality over time. So basically, at the end of the day, after all these layering effects that we're going to pass through the model, we'll have a new baseline, a new COVID-19 forecast based on all these effects. And at some point, we'll likely then start testing economic mitigations. policy response to long-term recovery? How do we facilitate that? And is there a difference? I think Cameron's going to walk you through some of the other forecasts that are coming out of the different groups, Moody's, Deutsche Bank, Pantheon, and it could be that we're comparing our new COVID-19 forecast to theirs and see how economic mitigations play out against the different forecasts. That's a longer term effort. I think first out the door, we're just trying to get how could the epi mitigation really affect the economic performance over time, taking into account some of these changes in consumption and productivity from working from home. So that basically concludes our presentation and where we currently are. I think Walt and I will either take questions next or Cameron will come back on to finish the presentation. Thank you.
Wonderful. Yes. Sorry, I'm just waiting for the slide update. We've had a little bit of latency here. So I think for the time being, we'll ask a couple of questions of our Sandia presenters. And then I'll ask those of you who are interested to stay with us and talk about some concrete modeling demonstrations and some specifically some looks at specific tools that folks can use to get a grasp on the scale and the different areas impacted as a result of coronavirus. But for now, we're going to address a few questions for the Sandia presentation. First, Vanessa, would you mind discussing the different ramifications between morbidity and mortality again? I think you went into that previously, but perhaps a bit more detail there.
So morbidity reflects illness, general feedback. So that would be those that are getting ill. And some portion of those that get ill will die, and that's the mortality. And the epi models, I think, have been running for a little bit, trying to produce those estimates. And probably at the same time, they're testing different mitigation strategies. Previously, for the flu pandemic, I believe we had things like vaccines, an intervention vaccine, social distancing, rates at which we stay home from school, keep the kids home from school. So I imagine we'll be passing through the same things to see how that changes the morbidity and mortality, that is illness and death over time. And last time we addressed the changes in morbidity through absenteeism, which we then translated into productivity levels in the model by industry, by state. I assume we'll also be doing the same thing. A mortality, that will be passed through the model in terms of survivability. We can go in there, depending on which model you have. I think we all have this or don't. I'm not really sure. But you can go through there and affect the survivability of your population over time. I assume we'll do the same thing again and see how they pass through the economy under different epi mitigation strategies. Walt, did you have anything more to say on morbidity or mortality?
Yeah, maybe just a little bit on the estimation of those. I think folks who've been reading about this know that there's some uncertainty yet about the demographic factors and whether or not it tends to really be fatal for older folks or not. And there's some variability in observations about that, both from Wuhan and from Lombardy and from New York. And so it's not, I think there's some uncertainty about how the mortality will strike different demographics. And of course, there's the feedback with the availability to treat people on ventilators as well. So there's some coupling, of course, the quality of medical care and hydration and how that may be. So yeah, we will be considering those factors, but there's again some uncertainty about how this disease manifests in different populations and comorbidities of the folks who contract it.
Wonderful, thank you both. Can you speak at all to the any modeling or thought you might have given to federal responses or potential state responses or any other sort of mitigation or resilient behavior?
So I'll address that. I know I've had my interns go through my state and pull, try to maintain a database on what exactly the strategies for mitigation from an economic perspective have been. You know, I'll mention California. They've been giving out health vouchers to those that are lower income and homeless. Come in, present your voucher. You can get medical treatment basically for free to the individual. I mean, there's always a cost. I think I've been on phone calls where we're hearing, you know, Alaska themselves are going to pay out to their citizens, maybe on top of what the dividend already pays out. With regard to resilience, I know I got this question last week. Are some communities more resilient than others because they've experienced past disruptions? I have seen that in some regions, that it's spurred them to be better planners and better responders and have response plans. I know I work with some communities that have been hit previously, I'll say along the Hurricane Alley or Hurricane region, the Gulf region, and I would be unimpressed with their plans to address a better response going forward, and maybe not a lot of resilience from what, you know, electric power and things like that we might see improvements in. So I can't say that the healthcare would be greatly improved either. Walt, from a mitigation standpoint for the epi side, I don't know how you guys are handling that, if at all, by state.
So we're typically looking at the compliance with the social distancing as a parameter on controlling the rates of interactions. So typically, yeah, that's typically what the epidemiological models are focusing on, is the compliance or the changes in behavior that those policies induce. And again, if you're doing a small scale model, you're representing those, you know, individual trips that people might make during a day, and now they're staying at home and interacting more within their family than outside. On the larger scale models, that's a sort of an adjustable parameter that you may just scale in proportion to the reduced numbers of trips or the amount of time that people spend at home. So that's kind of the way the policies, federal policies, are reflected in the epi end of things.
Thank you both for that detailed response. So we've got a really interesting question here. Somebody has pointed out that one aspect of early mitigation in most countries seems to be the avoidance of panic and the encouragement of people not to undertake excess mitigation measures in hopes of avoiding any sort of economic damages above and beyond what a pandemic promises to bring. Additionally, we're seeing policy conversations in this space on the trade-off between economic and mitigation priorities. Have you at all looked into this trade-off or the role the two play, or do you have any evidence that panic might be of the same kind of tier of disruption as the pandemic itself?
Walt, I'll take a first cut at that. So I think we are trying to evaluate those trade-offs, and I think we did try to do that somewhat in the previous pandemic study, the flu pandemic. I think this is a very different situation in that there is large uncertainty around transmission, age cohorts affected, immunities, levels of us ever having a vaccine in the future, things like that. So there is much more uncertainty probably with this when compared to a flu pandemic. I can speak to previous scenarios that I've run with regard to radiological dispersion device, specifically one rural ag region where I would say the policymakers said, we will clean up to any detectable level. Not a hint of radiation will ever be detected in this region again. That's how we're going to have to do it. That's how we want to respond, because we want to have, we want our customers to have faith in the ag products that come out of here. So we followed their policy response. And basically we had to lose an entire ag region, no longer usable, because we have to guarantee to the consumer that never ever would anything pass through. And for a lot of regions in the country, there is background radiation and things like that we don't have measured for every square foot. So the economic ramifications of that was quite large. And I don't want to call it a panic response. I want to call it an ad hoc policy decision. Given the lack of information or lack of planned response, or working through what are the outcomes of possible policy responses, right? That they've sat down, they had this thought exercise. There was no option but the ad hoc. And I think that ad hoc policy really, in our scenario, all pretend, caused a lot of economic loss that was not going to be recovered. So yeah, those decisions can have long-term implications, and all of us are trying to estimate those now and figure out those trade-offs. But capture that very carefully. Walt, do you have anything to say with regard to fear response or panic response with EPI?
No, I think there's, well, I understand that. I think the question is the early government mitigation seemed to emphasize avoiding panic, and I guess it seems that there was some government's response was to downplay the potential ramifications of the disease. So I think that's true, and I don't know if that it was necessarily with the intention of avoiding panic or just to try to perhaps downplay the prospective consequences of it. So I don't. Yeah. So I think maybe that's the only point I'd make there.
Wonderful. Thank you for that in-depth response. So my last question I'll leave you with, on the mitigation side, as people begin to think about, well, what can we do with this information? How does this help us? Possibly a two-part question here. The first being, what research or analysis have you done looking into the timing of response and the implications of that? And the second part being, what strategies do you see as being best suited for mitigating this kind of response, and what do you think people can be doing, both from the economic and from the epidemiological perspective, to mitigate? So the question is, best practices for mitigation, economics and epidemiology wise, and the timing of any responses that you suggest.
So Vanessa, can I maybe just start with a quick epi thought, and then?
I would recommend starting with the epi, because everything I do depends on the epi. Go for it.
Yeah, and I think maybe the only point I wanted to make about the timing is that one of the challenges of managing this particular disease seems to be the fairly long, or at least the prospect of cases manifesting quite a long time after social distancing measures have been put in place, and whether that's to do with a lot of mildly symptomatic or pre-symptomatic transmission in the population, or exactly what the biological explanation of that is. There seems to be a fairly long lag time between the imposition of controls and then the manifestation of the beneficial effects of those in terms of reducing the case counts. And so that seems to present a special challenge in terms of managing people's response to this outbreak, because there is such a long delay between the costs that they're asked to undergo, and then the beneficial effects of that. So it may be just a feature that makes this difficult. Another aspect of that.
And I'll say from an economic side, Sandia Labs is an unbiased broker. I cannot recommend or endorse the policy. All I can do is evaluate them. I can say from past disaster analysis work we've seen, a lot of our economic activity is driven by the small business, and a lot of the people being affected now are wage workers. Probably a lot of us on the phone are salaried workers, and we can maintain our salary. We're working right now, right? So I would like to see how things play out when they're pointed at small businesses and individuals, and see if that's helpful or not. Overall, it's going to be interesting to see. I think past pandemics, when I've gone through the literature and sort of looked at this in depth, there's been increases in wages and productivity following an event like this. I want to paint this as a positive, but there's innovations that will happen that will likely play out over time. We can't guess at those. But I know, we'll be comparing different policies and see what those outcomes might be, but I can't say with any certainty. Like, I'd like to see the following or not, but we'll see how they play out, and we'll likely have an update to this presentation.
Wonderful. Thank you both so much for such interesting and valuable insights. I hope all of our attendees appreciate the time that these folks have been putting into preparing this presentation, and the carefulness and in the approach that they've brought to this. So we really appreciate your time, certainly. And for those of us who are interested, we're going to transition at this point into a demonstration of modeling approaches and concrete technical strategies that REMI, Regional Economic Models, recommends for clients and interested parties who are hoping to get a handle on the economic ramifications of such a pandemic. So we're going to switch over to another presentation at this point for the next 7 minutes that we have left on the webinar here. So right now, with the time we have left, I'm going to talk about 3 main problems that REMI is hoping to tackle in suggesting modeling responses in reaction to coronavirus. Those 3 main points are as follows. We want to provide a simple, quick to implement strategy for state and regional forecasting based on COVID-19 repercussions. And so the 3 things that we think are important and we think that people need to take into consideration here are we need it to be adjustable and resilient in the face of new assumptions. Obviously, this is a fast-moving and surprising pandemic in many ways. And as new information trickles in and new resilience responses come in, we need to be, on our toes to deliver the best analysis that fits our given data. 2, we need to be able to take a look at a couple of different ramifications. 1, the implication on sort of international and national trends on regional economies. Obviously, in some ways, this is kind of above the scale of anything that a region can sort of approach. We are at the point where this is a national pandemic, and short of closing regional borders, and state borders, there's not much that we can do to get a grasp on this thing as a region, besides encouraging better practices internally, as so much of the main impacts are external, and certainly at the economic level. And then the third thing we want to get a handle on is how our regional mitigation strategies and specific regional our regional characteristics lead to a difference in outcomes. So to reiterate, the 3 points that we want to be able to address are a quick solution that's easily adaptable. 2, we want to be able to take a look at how the federal forecasts and changes affect the regional level. And 3, we want to get a handle on how our regional policies and how specific regional effects result in new outcomes at the regional level. So a kind of 3-part question here. And so briefly, we don't have much time, so I won't get too much into it, but regional economic models has been in the policy analysis space for 40 years now, taking a rigorous economic approach to questions of policy importance. And so we've taken some of our, some economic theories that are specifically delivered by the REMI model, and we've applied it to this question, which is of utmost importance to many organizations, but revenue organizations who need to use projections of economic outcomes to forecast their state revenues and expenditures, especially. So we hope that this solution can be seen by those sorts of organizations, among many others. So what we're going to do to model this simulation is we're going to take a baseline national forecast from external sources. We're going to plug that into our national control so that we can drive a sort of lower GDP growth forecast using sort of external data sources. We're going to use that to drive a state and regional response, and so we'll automatically be able to update a regional ramifications from a national response, taking into account specific trade relationships, industry clusters, and several other qualities of regional economies. And then third, we're going to adjust for what ifs in the region. So let's transition over to this, the REMI tax PI software. I'll show you very briefly because we don't have a ton of time left, just a couple of minutes left. So it should be very quick here. Oh, sorry. I realize we have my screen open here. Okay. Sorry, I meant the other screen to be visible. Okay, so here on our screen, we should be able to see our tax PI software. What we've done basically is updated our national forecast with a change in our national growth rate of what amounts to a 13% Q2 drop in GDP at the national level. This is the forecast that we're borrowing from Deutsche Bank. And so we've populated our national control with that data and looking into specific impacts at the, here we go, looking at specific impacts for several GDP categories. So everything I'm doing on the screen would be possible for folks who have the REMI model. So we've taken our decline in our GDP baseline, and we've plugged that in here for our 2020. We can see from 2019 to 2020 that our GDP categories for our 85 major GDP components have been externally decreased, and so we're going to be using that. And so we can measure both the response in terms of economic outputs at the national level, which I'm changing to here. We can see the adjustments here. If I do differences from our standard national control to the adjusted national control, we can see we've lost a significant number of jobs, of GDP, of output as a result of this forecast update. And that has specifically been driven by our 85 GDP characteristics that we adjusted in the national forecast update. We've used that to drive a regional forecast, which takes into account the regional relationships between, what amount of national demand that certain regions satisfy, and the different industries that certain regions excel at. So we're able to use the national result to drive specific regional results. And then we took a look at specific policy intervention, which in this case actually just represented a closure of restaurants and bars. So we took a look at a 50% decrease in output in Q2 in Texas. Actually, we're looking at the Texas economy. And I'm running a bit over here. I apologize, everybody, for going over. But so we've time discounted actually that input. And so what would be a 50% drop in Q2, we're representing as a 12.5% drop for the year, as REMI is an annual model. And so we're going to look at the results, which are going to show us in terms of difference to the regional updated control, which already considers the national implications. We're going to take a look at the additional regional implications of this restaurant and bar shutdown. So this can help policymakers who are deciding in a sort of uncertain environment where a lot of changes are being driven by national trends. What are the regional trends, and what are the impacts that our policies are having at the regional level? So we can see here that our 50% Q2 restaurant and bar closure impact is resulting in declines in employment, 220,000 jobs, of a loss of $11 billion of GDP. And this is assumed to be sort of an annual implication of a Q2 closure. Now, I should say that this does not account for at all the impacts of the mitigation strategies in terms of the pandemic. So we're not taking a look at the reduced mortality and morbidity, as Vanessa mentioned, that we're driving. So indeed, actually, that would be a positive response of this restaurant and bar closure. And so by taking into account specific data on, mortality and morbidity, one could get sort of at that cost benefit calculation that some people are hoping to drive at it. At what point does the panic outweigh the panic and the economic response outweigh the benefits of mitigation at some theoretical level? So that information could be integrated here. And I'll show off one other feature too. We have customized this model with budget information that, we have a customized budget that's overlaid on top of all economic outputs in this model. So basically we created custom budget categories for revenues such as sales tax, income tax, business tax, each revenue category can be driven by an economic result in the model. So in this case, since we are decreasing output by restaurants, we're actually seeing a decrease in sales tax revenue driven by that decrease in restaurant consumption, which is of supreme importance to many state policymakers right now, what the implications of certain policy decisions are on revenue and indeed what the overall implications are at a national level. We can even take this number in comparison to our sort of budget baseline. So that budget number was comparing our budget to a situation in which we hadn't implemented the restaurant closure, but we still had coronavirus. By comparing it to our budget baseline, we can see the total impact of coronavirus plus the restaurant closure, which are obviously of a much larger magnitude. So one is able to get some very flexible, one is able to get a variety of different analytical results just by a relatively simple analysis. We hope this can be of use, this framework, to policymakers at the state and federal level. So please feel free to ask any questions about this simulation that we've taken a look at here today, and about either presentation in the coming days. As I mentioned, we'll wrap things up here. We will be sending out a follow-up email with slides and a recording of today's presentation that will include contact information for Sandia, Vanessa, and Walt, and the REMI team will be reachable through that email as well. So we look forward to receiving any questions you might have. Thank you all so much for your attendance. We appreciate the insightful and the insightful questions and the wide variety of questions that we got. And of course, we would love to thank the Sandia team for making themselves available and delivering such a important and timely presentation today. So thanks you guys, and thanks everybody for attending. We will stay on the line for just a few minutes to answer any questions on the REMI side. But without further ado, I think I'll say my farewell, and I'll let the Sandia team do so as well if they like.
Thank you, Carmen, and thank you for everybody for participating. I know we can't get to every question. I think they'll provide us with some of the questions later. Carmen, I don't know if there is a select few of questions you wanted to run through. And I think Walter is still on the line.
Yeah, yes, I am, Vanessa.
Yep, I'm looking at the questions now, and I think we're good for the time being. So I think we're good to end it here. So yeah, thank you all for attending, and thank you so much to the Sandia team for their great presentation.
Thank you. Bye-bye.